Welcome to this recorded academic webinar hosted by the Indian Association of Physician Assistants. This session features Ms. Hemalatha Raghuraman, a lead cardiac sonographer from Australia, sharing her inspiring journey and insights on purpose, passion, and perseverance path to success in the physician associate profession. We hope you find the discussions insightful and empowering. Ms. Hemalatha reflects on her global career journey from Chennai to Perth and highlights how embracing challenges with resilience can lead to personal and professional growth. She also emphasizes the vital role physician associates play in bridging the gap between care and cure within the healthcare system.
Once you face the realities of the fierce competition and all the barriers that you need to cross to get there, I realized that it was not going to be easy to become a doctor. And so I just did a bachelor's in nutrition, which I thought was like like a similar alternative or somewhere connected to the healthcare field. So once I finished my bachelor's, I was exploring options for doing master's when I came across this program called physician assistant. I really didn't know what to expect from it. I just thought, okay, this looks something connected with the hospital. Let me just try it. And after I joined the course, after I went through the training and everything, um, and then as I said, when I came to the eco lab, something clicked, and I thought, okay, this is what I want to do. This is what interests me, and I should make this my why. So in many ways, like what I am doing today is has actually fulfilled my dream of what I wanted to become. So I may not be a doctor, I may not be having like a degree or a designation with me, but every day I'm making diagnostic decisions, which is helping someone, live healthy, or someone to get a good treatment. I'm helping the community, I'm giving back to the community, and I feel good every day when I finish. So, your purpose or your why can be similar to mine or something different, but understanding what it is very crucial. And once you know why you are doing it, and the how and what and everything will fall into its place. The next one is passion. A skill can be learned through studying, training, or repetitively doing something. But what you achieve using those skills is determined by your passion. Passion is what sets you apart. Like if you're going to do the same thing as someone else, then you don't stand out. You need to have that internal spark in you, which, pushes you to go beyond the minimum, to strive for excellence, and to continuously evolve in whatever you are doing. So passion creates a distinction between you and your, peer basically. So to be honest, like every job, however, meaningful it is, it becomes a routine after some time. Every day you're coming in, doing the same thing and then going back. But when you are driven by passion, even the familiar things that you do every day feel fresh. And each day presents as a new challenge to you. So every day you want to achieve something, every day you want to learn something new, every day feels like a new opportunity. And the intensity of your commitment, the dedication and devotion that you show to your work, especially when no one is watching, like it is like self discipline that you show, elevates you above the ordinary. Um, so, passion is what makes a work from becoming just a job. So, how do we keep this passion alive? That's when we look for inspirations. Like, we look for people who have achieved things, not to compare ourselves, but at least, to aim for things, higher things from what we are, to do something different from what we are doing every day. Um, inspiration can be in the form of like anyone or anything. It can be your peers, it can be your seniors, it can be even a person who is your junior. Everybody can teach you small things, everybody can inspire you. Um, so when you let your passion fuel your profession and your purpose, it will become your profession. So passion is what takes us through, like the trying times in life. So next one is the perseverance. Perseverance, by definition, is a determination to keep doing something despite any hurdle. So it's actually the determination to hold on to your purpose and passion, even when you're facing unfamiliar or overwhelming situations. It is the inner strength that keeps moving you forward, especially when the path is not smooth. So, when I moved to Australia, everything was different. Like the way things work in India is totally different. It was, like a different culture, different people, language, accents, systems of work, protocols. Everything was different. So it was something a lot to take at one time at that, and it did feel a bit overwhelming, but my focus was very clear. I mean, I got this opportunity, I have to make use of it. I have to prove that I can adapt, and I have to prove that I'm capable of what I can do, and I have to show everyone what I can do and succeed. That was what in my mind. And I just keep reminding myself that, I can stay committed, I'm open to learning, and I can find my way around. And I did. And I did prove like what I could do. So when you set your mind to something and you combine it with consistent effort, you can truly achieve what you aim for. And of course, perseverance does not mean doing everything on your own. So you have a lot of support systems during challenging time that you can reach to. Like for example, the IAPA. Like we have our seniors with n number of years of experience, um, who can help us or who can help you when you are in trouble. Whenever you have an issue, you can always talk to people around you, your colleagues, friends. Everybody will have some valuable perspective. And all you have to do is just talk openly and ask for help. Mindfulness and self care is very, very important, which means that even if you feel low, just don't let it drag you down. I mean, just tell yourself it's just a small situation, and this time will just tide away. All I have to do is just hang in there. And then there are things that you can do to be prepared for situations, which is like continuous learning, keeping yourself updated in your field gives you a lot of inner confidence, and that can help you to overcome any problems that you face. Okay, so when we say success is not like it's not a destination. Basically, it's just a journey, and the if for each one it is different, like it is deeply personal. Like it does not mean the success for me is the same as success for you, and you have a freedom to choose or define what you mean is successful for yourself. It can be like as modest as you want, us as ambitious as you choose. The aim is to achieve what you define as success for yourself, and the path to get there is pretty straightforward. You set small goals, try to work towards them, achieve that goal, and every time you achieve something, celebrate and then start the next one. So these small victories will build momentum and will reinforce your progress. As I said, continuous professional development. Staying updated in your field is a very important part of having all those elements for success. Dedication, hard work, self-confidence, optimism, these are all like important parts for you to reach those goals. And look for opportunities, and whenever you get an opportunity, try to make use of it in the most advantageous way for yourself. Just don't back out saying I may or may not be able to do this. Just give it a go. Whether you do it or not, that doesn't really matter, but you have attempted it, and even if you fail, you have learned something from that. That's what you need to take from it. So be open to opportunities and do not hesitate to step beyond your comfort zone. Only when we explore, uncharted territories, we can probably find out what our true potentials are. And don't hesitate to, seek support when you need it. Utilize all the resources that you have, the networks that you have, and asking for help is not a sign of weakness. It is another sign of strength. It takes more strength to ask for help, actually. So, to summarize, purpose or why guides your decisions, and passion fuels your growth, and perseverance helps you to tide through your lows. So, these are not just values, these are like survival skills for us in healthcare. When these three align, you just don't have a job, you have a mission. And whether you are just beginning your career or you have decades of experience behind you, this formula will keep you empowered and help you to adapt and grow and lead. Purpose is what draws us to medicine, passion is what keeps us engaged, and perseverance is what transforms us from students to leaders. We may be like in different continents, different countries, but as such, all the challenges we face and all the emotions we experience are the same. As physician associates, our journey may look different, but the core of what drives us is remarkably the same. So, from my talk today, I would love if you could just go back and think about what is or what was your purpose for, becoming a physician associate, and what fuels your passion, and when or how you have shown perseverance, and what challenges you have faced. So these questions are not only reflective, but they're also empowering, and they help us to reconnect with ourselves, help us to continue to grow in this incredible profession. Thank you for your time and the work you do, and for being a part of this beautiful community.
Thank you, ma'am. Thank you so much. It was wonderful. Your words truly motivated, would have motivated the young PAs as well, the seasoned PAs. So thank you so much for your time. And I request Gomati ma'am to conclude this wonderful evening with her concluding remarks.
I would like to talk more than just a mere conclusion. Thank you very much, Hema. So you mentioned about the persons who you inspired. One you told about the name, that is Sudha. We would try to get Sudha here on one session. Sudha is also a very remarkable person. She is now in the UK, also she is in echocardiography, right, Hema?
Yeah.
Hema is an incredible person. More on Hema, little in a short while. In the meantime, yeah, the one that she didn't mention, she didn't speak out as Mahendra Singh Dhoni. So she did mention in her slide. So that was a very apt example that when you face challenges, staying calm and think and do the right things to do at that particular point of time. It's important then to just react to the situation, react properly. If you have any problems, we are in patient care, so we need to deal with such things only afterwards and after finishing our responsibility. So, a lot of people joined late to this meeting. I know that you are and are a dedicated professional and a very highly regarded PA in MMM, and sure in your present institution also that would be the same case. Can you just tell a little bit about a day in your professional life, both in MMM and Australia, and how do you compare and contrast both? Just a few words about it.
Sure, ma'am. Yeah, as I said, the work culture is totally different. So in Western countries, obviously, they go by protocols more, whereas in India, we do follow a protocol, but it's not like so staunch. So in India, probably the workload is quite high comparatively. I don't do so many patients here, but every scan is done in a more detailed way here. We give more importance to, taking so many images, so many measurements, going by the proper American Society of Echo protocols. And obviously, pathologies are different as well. We need to adapt to that. Probably in India, we see more pathology, not much here. And the other thing here is that in MMM, we have the cardiologist right there. Like if I have any issues, I can just call them, ask them for their opinion. But here it is not like that. So whatever we scan, it is analyzed by a cardiologist offline, and then they give their comments on it. But most of the time, the doctors treat by whatever we write in the preliminary. We are allowed to do that. And even in India, we do that. It's nothing different here, though. But most of them, yeah, they do take our the report that we do, and then they use it to treat the patients. So that way, I feel that we're more independent here.
I'm sure at those times you had a lot of rheumatic valvular heart disease also.
Yeah, in India, yeah, exactly. That's what. Even here, like as I said, rheumatic is not that common in the white population.
But because of the longevity, you might be still seeing valvular pathology, right? Especially mitral and all that. Old age people, LV dysfunctions.
Yeah, degenerative disease, yes,
Genetic.
but not rheumatic so much.
Okay. So that's very nice. And we would try to get Hema later on subject. So
Yeah, I would rather do all subject than something.
yeah. No. The thing is, I wanted to actually tell that, like, because this is the first. Earlier, we did have IAPA was conducting some, online sessions like this, but it was interrupted and all that. Now, Maha, to all the participants, I would like to say that the vice president of the IAPA is the academic head also. Mahalakshmi and the team have planned a lot of academic events, both online, and on site. So they are bringing up a lot of, they want to go systematically and keep you all engaged at least twice a month. So she'll be coming out with all those programs as soon as possible. But what Maha wanted was to start this journey with an inspirational talk. And who else which you would call that a person who almost pulled out echocardiography. So GKNM would have lost a very good person in cardiac surgery if he had gone there. So that was the reason why, of course, your talk was inspirational. And though you didn't want to, you are not very keen on that kind of a topic. But definitely, we will want you to come back and give us something about the echo scales, or you and Maha could decide on that, and Sudha as well. And I'm sure we also know that we have lots of pearls like you in the IAPA, and there are some more to be discovered as well. So we'll work on that, and we will try to make this as useful as possible for the students. It must be past midnight, and you are a little bit sick as well because of the weather there. I should thank you very, very much for joining.
Any questions from the audience?
Yes, if anyone wants to ask anything to Hema, only that person unmute, please, and ask her. And please, no questions on how to move to Australia. Okay, she can deal with that separately. If there are any questions.
Hello, ma'am. I'm Pratap.
Hi, Pratap.
Hi, ma'am. I'm from India, in Coimbatore, working PA.
Nice to meet you.
Yeah, ma'am. Ma'am, how can you got a job in Australia, like in abroad countries? Because why I'm asking that I come to only BSc. So can get a job under the BSc degree in abroad countries, or else anything I can do? I should do any other courses like MSc or any technical course? Is there any?
Pratap, if I can interrupt you, I think we should have a session on that specifically, and we will invite Hema and others who have moved out. You know, there are so many of our PAs who have gone to different countries. We were planning to have a complete session on that too. You know, there are so many queries that we are getting on, you know, how to go abroad and work. So we are also figuring out how to do that, you know, and we are engaged in talks with the US and the UK and Middle East and everywhere. So at that time, we will also invite Hema and people like her, and you know, you can join and ask questions on that. That is why when I opened this forum for questions, I specifically said, do not ask such questions. We are just postponing this question for some other session. That is all, Pratap. Nothing else. So we would like to keep this a little bit, you know, aligned to the topic that we're talking today. Or anything in ECHO also, she'll be happy to answer.
Sorry, ma'am. This is my first Zoom meet.
No problem. No problem. Yeah. Just before opening this for questions, I told you specifically, we will shortly arrange for us a separate session on this. On Indian PAs moving abroad. What are the challenges? Which are the countries that allow us or they don't allow us? So we will do that shortly.
Okay, thank you.
Thank you very much. Any questions for Hema, or should we send her to sleep? Swati, I think you can talk to Hema. You have texted something. Swati, can you hear me?
Yes, ma'am. Hi, I'm Swati. I have currently started my internship program in Chennai.
Okay.
I'm more involved in, like I said, I am more involved in cardiothoracic and vascular surgery as a surgical PA.
Okay.
But I don't know how to pursue one.
You are in the surgical side, cardiothoracic side.
No, I'm not in, but I have to become one.
So, which hospital you are doing your program in?
Gleneagles Hospital, Chennai, ma'am.
So you don't have a cardiovascular program there? I mean, setup?
Yeah, it's here. We'll do internship for 1 month only, ma'am.
1 month in that. Okay.
Um,
So you can also, you know, through your institute, go for an external internship if you want, or even there you can extend. After completing your course also, you can ask them to, you know, give you some hands-on over there. Something like that, you can make an arrangement. Because of,
Yes.
you know, there is some possibility of government jobs opening for us. So we were asked to include primary care into this. That is why 6 months of primary care and 6 months of 6 months of specialty care. We made the curriculum like that, and MGR University adopted it. And I don't know what happened after that. If that 6 months was allowed, you could have opted for cardiac surgery during those 6 months' time. I think they changed all the curriculum, the syllabus, and all that. So unfortunately, it's like that. And you can very well request them after completing if they can take you as, you can join there or you can join somewhere else. And this 1 month definitely is not going to be enough. Maybe you can extend.
Ma'am,
Have an
can I
arrangement with
pursue
them.
MSc in that particular program, ma'am?
MSc, yes, even if you have 1 month of exposure, MSc should not be a problem for you. But there are very few universities offering MSc. This will pick up in time, but I would suggest, if you ask me personally, I'm telling everyone to work at least for one year before you go in for a master's degree. So that experience will help you a lot.
Okay, ma'am.
Work for a year and then go for a master's degree.
Okay, ma'am. That's what I too was thinking about.
Yeah. Whoever asks me, I say that work for a year or two if you can, and then pursue a master's degree. So you will know how much you can pick up in a master's degree if you go after a patient care exposure.
Thank
Hema,
you,
do you want
ma'am.
to add anything to that?
No, ma'am, I agree.
So,
Thank you, ma'am.
Thank you. Someone is coming in now. What do we do? Say good night, everyone. Yes, thank you all. Thank you, Hema, especially. So
No worries.
meet on some other session and keep watching our announcements to get the best of it. And I would urge all the PAs to become IAPA members. You know what is happening, and we are trying to give as much as possible everything free for our members as well as non-members. Whether you want to support IAPA or not, we want to support all PAs, whether you are an IAPA member or not. But definitely, the association cannot work with this meager 5,000 rupees life membership. So we don't want to increase the life membership, but at least we can increase on members, right? That we can do. So I would request all of you all to become members of IAPA ASAP. Possible. Thank you, everyone. Maha, thank you very much for this nice talk, arrangements, and all that. Thank you. Thank you all.
Thank you, ma'am. Thank you for your support as well. Thank you so much.
Bye.
Bye, ma'am.
Thank you. See you guys.
Thank you, ma'am. Bye. Good night.